Hi, I'm Dr. Kate Sobiak from UW-Whitewater. I was pleased to have the opportunity to work with my senior health communication capstone course in health advocacy with a topic of vaping education. This had many facets, and I am just going to talk about this topic of vaping education that was conducted at Whitewater Middle School. This is a look at my poster overall, but I'll talk about it in components. So I have screenshots of this so that it's much easier for us to follow. As many of you probably are aware, vaping has really swept the adolescent and young adult population, in particular in the United States. Late last year and really early into this year, there have been many kinds of regulations that have been at the state and even federal level for access to these kinds of products, actually barring them if you're not 21 years or older. And also, the FDA declared this to be a public health crisis and an epidemic, according to the Centers for Disease Control, late in 2019. Juul was a brand that was of particular note, probably appealing because it's easily hidden, resembles a technology, a USB flash drive, comes in lots of different flavors appealing to youth, and just is cool, at least to that population. My students in the Health Communication Advocacy and Message Design class during the spring semester of 2019 developed a 30-minute classroom presentation. There were 8 health education classes at Whitewater Middle School that semester, and with the number of students I had, it wound up being 2 students per class. Prior to being able to do the presentations, students were required to complete city training in order to be considered researchers at the undergraduate level. So all did that right out of the gate. They also went to the Taking Down Tobacco site, which is funded by CVS Pharmacy, and completed a course called Tobacco 101, which helped them develop materials for the middle school population. We also, as a group, looked at NIH materials, National Institutes of Health, to select what would be best for the middle school students and the parents also to provide to them either in class or in the setting of parent-teacher conferences. We wanted to make sure that we had materials also in Spanish because 40% of the parents of Whitewater Middle School students are Spanish speaking. I've been working with the area's American Lung Association on a program called SPARK, and that is to implement tobacco-free policies at the college level, but they have a wealth of materials also that can be used at the high school and middle school populations. They had gone into Whitewater Middle School and was able to have a brief survey conducted with the health education classes. I'm just presenting that here. I guess the most telling information is that they don't readily admit to vaping on the survey, but also in that bottom right hand corner, the question is, do you believe that tobacco companies try to get young people under 18 to use tobacco products, and the vast majority did not believe that to be the case, when in fact there's ample evidence to the contrary. So through getting permission by the Whitewater Middle School principal, and also through connections to the two health education teachers, we were able to take over basically a class period, 30 minutes of which would be the presentations by my students, and then allowing for question and answers, which took place 4 classes per day over 2 days of the week to make sure we captured all of the health education students. Shortly thereafter, there were parent-teacher conferences, and my students also took part in tabling, meaning trying to capture the attention of parents who were at the middle school in order to, obviously talk to their students' or teachers. Often the students were along as well, so we tried to engage both the students and the parents to provide vaping education. There were various ways that students that were in charge of their 30-minute sessions tried to engage these middle school students and tried to enhance their learning about the dangers of vaping. Some did physical puzzles that they had the students put together. Some might do a game of something like stand up, sit down, duck, duck, goose, something along those lines to get students all talking. Some type of icebreaker-ish or icebreaker-like game. One class of 2 students of mine did a Kahoot in order to assess knowledge gain, which is just an example here. They had 15 questions and then were able to assess pre-test and post-test. Here's just a quick look at my students. They're in different environments here, from the classroom settings to one time not having access to the classroom because of a equipment failure in the classroom, and so they were moved to a library setting. That's the upper right hand corner. You can see at the bottom the little baggies. That's just some related materials with the hashtag not cool to Juul as something that was a theme that we carried out. Inside of those bags were things like gum and bubble wands and other types of things that were provided by the American Lung Association, such as mini flashlights and keychains and other similar products. Here's a quick look at the tabling that was held at right inside the entrance to the middle school. So you can see the backdrop is partly saying the name of the school. That's what you see when you first walk into the main doors of the middle school. So they had posters that were created, as you can see here, the trifold tabletop. There were kind of raffle-like spinning wheels for prizes. There were many educational materials that you can see partly laid out there on the tables in that upper left-hand corner. The upper right-hand corner shows a design of a button, which a student created. So those were handed out to whoever wanted them. As well as in the bottom left-hand corner, that's the business card design I had students do. Each one do just on one side to get a message quickly across. And then those were printed on cardstock and were also distributed. And we had a variety of those. And for these kinds of designs, we picked what would be the best designs to use by student vote. Here's just some more examples of the business card size. And the yellow caution, they also created labels which were to wrap around bubble wands in order to hand those out to the students. The bottom right are some more button designs, and the bottom left is a brochure that was both in English and Spanish, distributed to the parents. All in all, this was a very high impact practice experience, a HIP, if you will. That's one of the things we hear about all the time, and you probably have as well. That doing community-based learning, civic engagement is both rewarding, but also something that students really appreciate, particularly in retrospect. Using the students in this middle school environment appeared to be a highly successful way to engage the middle school students, not just having an adult lecturing to them. The health educators and middle school administrators rated the students' performances very highly, both in the classroom and for the parent-teacher conferences, which was great. We'd like, of course, more information about this, particularly longitudinal if possible, how providing this kind of information at pre-vaping might impact behavioral intent over more than just a short term of a classroom situation. I also want to thank those that were responsible for helping in either financial way or materials so that we could get these out at the classroom settings and to the parent-teacher conferences. I'd be happy to talk with anybody interested in this, and thank you for your time.